Today I'm going to talk about ketamine-assisted therapy. So here's the structure of ketamine-assisted therapy. We meet for preparation, which we're doing today, and then on your next appointment you'll come in for the ketamine administration. After you have the experience of ketamine, we'll debrief you, and then we want to integrate any type of insights or behavior changes that you want to adopt. And we kind of focus on that at the beginning of the next ketamine session, and we repeat that times 6 or 7 depending on how many sessions the psychiatrist orders. After that's done, we'll close out. So today I'm going over the preparation, and here's the topics that I'll cover. So how does the treatment work? This is my metaphor for how the treatment works. If you look here, it's a toboggan hill, so you got the mountain and you have all the rocks here on the mountain. What I like to say is that these shapes of the rocks and the mountain is kind of your genetics. Some people are more predisposed genetically to having anxiety or depression. And the reason for that, if you think back to the hunter-gatherer days, say if we came across a new animal on the savannah, the people who run out there to hunt the new source of food, they might get attacked and killed by whatever they met on the field. Whereas the person with anxiety who stayed back and hid in the bush, he would go on to live, or she would go on to live, and then would have, as a result, more babies and spread their anxiety or depression gene. So you could see why this makes sense. You could even see how this played out recently with COVID. When the vaccine came out, some people were ready to go get the vaccine that first thing, and others were more cautious and didn't get it at all. So if the vaccine ended up being harmful and killing a bunch of people, the people who were anxious and didn't want to get the vaccine would have spread their genetic material that would have made them more predisposed to not get that done. So that's our genetics. But then if you look on the hill, toboggan hill here, you see flags and trees. I call these the difficult thoughts, feelings, and situations that we run into in life. And then what is the toboggan run is kind of our neural pathways that we develop in our brain for handling these. So if you look here, the difficult thoughts, feelings, situations that you run into can be a trigger for a toboggan run. So say I'm in kindergarten and I meet up with a bully and I don't know what to do. The mind's kind of like a problem-solving machine. It focuses on the problem at hand and it just tries a bunch of different things to see what works. So say I run into a bully and my mind comes up with I know, I'll stand up for myself and say, hey, you can't do that, back off. So the mind tries that and it works. Oh, wow. And so what it does is it lays the beginning of a neural pathway or the beginning of the toboggan run. And the next time you run into that bully again, the mind remembers, hey, this worked last time, let's try it again. And if it works again, it gets more and more deeper the rut, and kind of over time that pathway gets more and more groomed till as soon as you meet a bully, your mind goes on autopilot and just kind of does its routine. So luckily you see here that behavior leads towards the life that you want, but unfortunately sometimes the toboggan runs can lead away from the life that you want. So an example could be, let's say you're in high school now, you're at a party, you're feeling socially awkward, you're not talkative, you're shy, you don't want to socialize, and someone gives you a drink of alcohol. You drink the alcohol and all of a sudden you feel more social, you don't feel anxious, you're more engaging, and the mind's like, that worked. If we find ourselves in this situation again, let's just drink some of this alcohol. It seems to work. So you can see how it may help you with the problem at hand, but over time, if you're drinking every time you feel a little bit anxious or you're feeling you have to engage socially, it can lead to alcoholism and away from the life that you want. So the same thing can happen with depression. People get into these thought patterns, kind of like the well-groomed toboggan run of negative self-judgments, maybe remorse or guilt about the past or anxiety about the future. So the mind, being the problem-solving machine it is, it uses these patterns that it developed to help deal with it. Like say in the past, you had some failure in your life and your mind beat you up saying you're no good, you're such a loser, no wonder why they don't want to be with you, you need to do better. And then so maybe that helped motivate you and change the behavior, so it helped deal with that problem. But you can see how when your mind gets rigid about these thoughts and just plays them over and over again, how it can lead away from the life that you want. So our goal here with ketamine, what ketamine does, it kind of works like a snow groomer. It doesn't get rid of the toboggan runs, but it makes the pull of them a little bit less. And then it also gives you insight into the difficult thoughts, feelings, and situations that you have in your life. And it also helps you define the values, like what is your towards moves in your life, like what do you value in your life. And so what our role here with ketamine therapy is we want to find out what are these difficult thoughts, feelings, situations that hook you, find out what are these normal patterns of thoughts that you have, and we want to teach you some skills to how to unhook when you find that you're getting caught by these ruts. We also want to define what are your values in your life and what kind of life do you want to live towards. So what that is called is psychological flexibility. So I talked about depression or anxiety. People have a very psychological, rigid way of looking at the world. So they have this rigid thought patterns that come up, the negative self-judgments, the remorse or anxiety about the future or past, the feelings of guilt. But someone who has psychological flexibility, they're able to notice those thoughts, use a coping skill and unhook from that toboggan run that they're running. And then they're able to look at what do I value in my life and walk towards that. So that's what our goal is with treatment, is go from these rigid thought patterns to a more flexible way of thinking. And ketamine helps us to develop those skills. The reason for that is, I'll get into the science of it. So basically ketamine, it binds to a receptor that causes glutamate to be blocked. Glutamate then circulates throughout your brain and causes a whole cascade of effects. But the end result of that is it releases a hormone called brain-derivative neurotrophic factor, or BDNF. And what BDNF, how I explain it to people, it's kind of like the miracle grow for the brain. So it allows new toboggan runs to be kind of laid. So that's why we go over different coping skills at the beginning of each session, because we're hoping to lay new pathways so when you run into this difficult thought, feeling, or emotion, instead of getting hooked by your old neural pathway of the self-judgments or anxiety about the past or future, we lay a new run that leads towards the life that you want. They actually done studies on people who had ketamine treatment, and just after the 6 sessions, if they did a scan of your brain, you'd see your old toboggan runs, and off of the neural pathways, you'd actually have these little spindles growing. So it's basically what's happening is that areas of your brain are starting to communicate that didn't talk before. And so after just 2 weeks of being on ketamine, you'd actually see this new growth off of these old neural pathways forming. And those are what I call, in this metaphor, the new toboggan runs. And we're hoping that they lead towards the life that you want. That being said, so ketamine, since people, they have the treatment and they start to feel well right away, sometimes they don't engage in the psychotherapy or practice the coping skills. And it's rather unfortunate, because after you have ketamine, that BDNF, that miracle grow for the brain, is actually spiked for the next 24 hours. So that's a good time to practice the coping skills so that we can lay these pathways. But unfortunately, over time, what happens is your body's immune system actually releases a bunch of glial cells that start to clean up those new pathways that have been developed. And so sometimes people get slumped back down into depression. So it's very important to practice the mindfulness skills, the different compassionate skills and stuff, so that we lay those tracks that go towards the life that you want. And again, these pathways, the snow groomer kind of dampens it. They're not as deep, but they're still there. So unfortunately, sometimes, like for instance, imagine if you have an alcohol use disorder and you have the intention to quit drinking, and then you run into difficult thought, feeling that kind of triggered this old pathway. People easily get hooked into that old way of thinking. It's kind of like the toboggan run. Imagine if you're late in the season going tobogganing, you think you're going to go down a chosen pathway, but you get hooked in one of these toboggan runs that the kids created, and next thing you know, you're going over jumps and stuff that you never intended to. So it's kind of the same thing with these old habits and routines. They can get triggered and you just get hooked by them. So again, I just want to reiterate the point that this is the prime time to really practice the mindfulness skills and the compassionate skills that we're going to teach you during your treatments. So at this point, I usually do a quick exercise on trying to find out what these values are. And the way I do that is, imagine ketamine works for you. You're no longer struggling with thoughts and feelings. So 2 weeks time, your treatment's done. You're no longer struggling. And I hire a video camera crew, and they come in and they film your life. And we're going to watch your life. What kind of things would we see on the videotape? What people would I see you engaging with? What activities would I see you doing? What would I see more of? And then the opposite of that, if I had the same film crew and they were following you for the last month, what would I see less of you doing? Would I see you doing less isolation in your room, perhaps, or avoiding people? So yeah, if we watch the tape of the last month, what would I see in this new experience where you're no longer struggling and ketamine's a success? What activities do I see you doing less of? Here's another metaphor that I use. So this picture, if you look above the waterline, this is kind of your conscious experience, everything that you're aware of. The water level is kind of your memories that you can kind of retrieve when you need to. You could reach into your memory storage and pull them back up and have a conscious experience of it. But below is your unconscious. So these are events that happen to you, traumas, memories and stuff that kind of you buried in your unconsciousness. So though you're unaware of it, it does affect your conscious life though. So the stuff that you have buried in your unconsciousness, all this trauma and different events that happen to you still affect your conscious life, but you're not aware of it. So what psychedelics like ketamine do is it reduces this water level so that this unconscious material starts to bubble up into your consciousness. And then what we do is once we get that material, we try to integrate it and change your behavior so that it changes your life that you're aware of. So yeah, our goal then with this ketamine treatment is to find new behaviors that you kind of commit to so that after you have the ketamine treatments done, you have a new way of looking, new thought patterns that kind of arrive for you. The effects of ketamine. So ketamine, it kicks in after we give the injection in about 3 to 4 minutes. It peaks in about 5 to 30 minutes. I usually find at the 15-minute mark is when I see the spike in blood pressure and pulse. The psychedelic experience lasts for about an hour. Most people 30 to 45 minutes, I'd say, in my experience. We have to monitor you for up to 2 hours. And then the medication at the 2-hour mark, you're ready to go. And then it takes about 3 to 4 hours till the medication is completely processed through your system. That being said, Northern Health recommends that if you have taken a general anesthetic, that you can't drive for 24 hours. And they recommend not signing any legal documents or engaging in any high-risk activities for 24 hours after you have taken the medication. This graph here shows just the 2 different routes. So this one here is IV. So since we can control the drip of the ketamine, it's a slower peak to get to the highest concentration in your bloodstream. And you can see though that once the IV stops, so the experience lasts a little bit longer, but then it decreases rapidly. Was the IM, the blood concentration gets up kind of right away, and then it tapers off after that. So with the IM, it's a higher blood concentration in a short period of time. So at that 15-minute mark, you can see we see it peak. The experience of ketamine. So ketamine is a weird medication. It's not just the dose, it's also your expectations going into it, your mindset, as well as the setting that you get it done in. So this graph here, it looks confusing, but I'll explain it. What they did is they gave 42 people this dose here, 6 micrograms per kilogram per minute, and then they gave 92 people twice the dose. And then they had them fill out a questionnaire, and then they plotted it. So you see here, disembodiment, more than 50% of the people said yes to it. So here's the questions that more than 50% of people said yes to. So it seemed to me as though I did not have a body anymore, had the feeling of being outside of my body. I felt as though I was floating. So more than 50% of the people said yes to this. That's what ketamine felt like. The second highest one is experience of unity. So that was the second most. So more than 40% of the people said yes to these questions. Everything seemed to unify into a oneness. It seemed to me that my environment and I were one. I experienced a touch of eternity. Conflicts and contradictions seemed to dissolve. And I experienced past, present, and future as a oneness. So more than 40% of the people said yes to that. Side effects. So I talked about the neurotransmitters that are released. So when you're on ketamine, not only does it release the BDNF, it releases norepinephrine, serotonin, and dopamine. So the norepinephrine causes a spike in blood pressure and pulse. So it's actually a measurement that I pay attention to. If I see no response in your blood pressure or pulse at the 15-minute mark, then I usually reach out to the psychiatrist to see if we should increase the dose, depending on the person's subjective experience. Serotonin, just like when you start an antidepressant, they say that it can cause nausea. That's because of the increase in serotonin that's circulating. So ketamine can increase the serotonin. Sometimes people can experience nausea and vomiting. And so we usually get an order for anti-nausea medications if this is for you. And then ketamine binds to the same receptor as alcohol. So alcohol binds to two different receptors. This one binds, the main one is the NMDA, and it gives kind of that impaired balance, the sedation type feeling, so incoordination. For the first hour after ketamine, people can not really walk. And for like up to an hour and a half after getting ketamine, their mobility is affected. And it's kind of like when you drink too much and you have that impaired balance. People don't feel the drunk feeling from it so much. It's more the impaired balance that they get. This, they just ask people, what does ketamine feel like? And here's the most descriptive word people said: spacey, strange, weird, bizarre, woozy, loopy, disassociation, visual disorders, floating. Floating's an interesting one. It's correlated to the antidepressant effect. So the more light you feel or floating you feel, generally the more of an antidepressant effect the ketamine has. So they don't know why those two are correlated. They don't necessarily think it causes the antidepressant, but if you experience that, that's a good sign that the medication will probably work. People experience numbness, difficulty speaking, delayed verbal response, and confusion. So the session. So again, I said that it's affected by the setting. So setting includes the music that we play. So the Ketamine Research Group actually puts out a playlist. You can click on it on their website and it'll take you to Spotify, and they have a bunch of different playlists created for ketamine therapy. The one that I generally use is by this artist, John Hopkins. He actually made a whole album specifically for ketamine therapy, and it follows a psychedelic music therapy arc of like there's an opening. So on this one, for instance, it sounds like a rocket taking off that's taking you from ordinary consciousness to a non-ordinary state of consciousness. Then trance-inducing music happens that leads to a breakthrough in heart music, and then to like a meditative relaxation at the end of it. So on this album, he actually went to Ecuador and he recorded the sounds of the caves. So you could think of that as a metaphor. You're going into the subconscious realm of your mind, which is kind of like a cave. And then what he does is he relays out of the cave up into the jungle canopy in Ecuador. So you can see that's the breakthrough. When he leaves the caves and he comes to the jungle canopy, you hear all the birds and animals kind of the jungle. And then he layered some harp music over it. And at the end of it, it's like a mother humming, bringing you back into the world, and it's kind of like being rocked gently. So I usually use this album and people really find it very effective. And if not, we switch up to one of the ones that the Ketamine Research Group puts out. So if you want to play around with the list, if after the first session we do this album and it's not effective for you, let us know and we'll switch it up. Quiet room, so we really want to have a quiet space. The headphones that we use are actually noise cancellation. We also give you eye shades. So this is kind of what you look like. You have the eye shades and the headphones on. And the reason for this is we want you to go internal. If your eyes are open and you're engaging, it becomes about the external world and not really kind of that inner world that we want to deal with. That being said, these are optional. If you don't want to wear the headphones or the eye shades, it's totally up to you. This is your treatment, but we highly recommend it. Presence of a therapist. So our role here is to support you. Again, this is your treatment. So whatever you want to do, whatever you want to bring in, as long as it's safe, we're more than happy to accommodate it. Sometimes if people want to bring a partner in, and we can accommodate that. There's no such thing as silly questions. And again, if you say anything during the sessions, it's confidential. And if you need to scream during the experience, go ahead and scream. Whatever that is safe will support you. We do ask you to remain seated for the whole hour. Just as due to that incoordination, you can harm yourself, trip, fall over. So we just ask you to stay in. And if you're trying to get up, we'll remind you of that and kind of make sure that you stay seated. Most of the times people just lay down for the whole and there's not much movement. So yeah, our goal here is to make sure that you feel safe. The thing with ketamine, sometimes, like I say, that disassociated feeling where people have the out of body experience, they might notice that they feel like they're not breathing. And so they could get quite panicky and scared. But I just want to let you know that we have a vitals machine on you. We're monitoring your oxygen levels. We actually have oxygen tanks in the room that if we need to give you oxygen, it's there. Only had to use oxygen twice, and it was with people who have a condition called sleep apnea. And so they probably run low on their oxygen levels when they're laying down already due to that medical condition. Ketamine is actually a very safe med. It's used in countries that can afford like the expensive breathing equipment and have anesthesiologists available. They actually use ketamine for the surgeries because you maintain your own breathing while you're on it. The other thing, though, sometimes people do get anxious during ketamine, so we just like to get consent from you now. So if we see you struggling or anxious, sometimes putting our hand on your wrist or holding your hand or touching your shoulder can be quite therapeutic for the person, grounds them back into this world and allows them to continue on their journey. So if you feel comfortable with that, just let the nurse that you're working with that you're okay with touch. Culture. So again, this is part of the setting, the culture that you come from. If there's any cultural practices that you want to incorporate, it could actually give more meaning for the treatment. So if you have any spiritual belief, like if you want to bring prayer, smudging, different rituals into it, we'll accommodate this to the best that we can. Some people want to bring objects in, like some people bring rocks that have special meanings to them and or pictures of loved ones. And so these things can have a meaning when you're in your journey and then afterwards as well. So yeah, feel free to bring this or incorporate any practices that you want, and we'll support you. The other thing is setting is that they actually done research. It shows that the more of like a living room or beautiful nature scene that people do psychedelics in and ketamine actually have more of an antidepressant effect versus a more medicalized room. So like they did a study where they did in a recovery room after surgery, and the ketamine wasn't as effective as it was when they did the same administration in their living room. They actually had more of antidepressant effects. So yeah, we try our best to make our rooms look nice and incorporate nature through use of plants and images on the wall. So mindset, this is what SET is. And so again, these are different coping skills that we're going to teach, and we hope that you incorporate in your life. But we do a couple of these before each treatment to kind of get you in a calm, relaxed state. So the first one that we do teach is kind of dropping anchor. What dropping anchor is it's just a way that if you're getting hooked by your thoughts, it's a way to get back into the present moment by paying attention to labeling the thoughts that you have in your mind, recognizing the sensations that are in your body, paying attention to things we see in the room, sounds that we hear, things that we can feel. And this is what psychological flexibility I talked about earlier, is being able to shift from the different things that your awareness could focus on. So instead of focusing on the thoughts that can be quite destructive or emotional storm, we drop an anchor and come back into the room so we're not being hooked by those difficult thoughts and feelings. Breathing exercise. So this one, you breathe in for 4 seconds, you hold, and then you blow out for 7 seconds. I'm sure that you heard deep breathing exercises in your life, but so rarely do people explain why we recommend breathing exercises. And the reason for this is you have what's called your vagal nerve. So your vagal nerve is the second largest nerve in your body compared next to the brainstem. And basically vagal means like wanderer in Latin. And basically it goes to your ear, the nerve goes to your heart, it goes to your lungs, it goes to your belly. And the breath can actually engage this vagal nerve, and that's why we recommend it. So when you breathe in, if I stuck a monitor and measured your heart rate, when you breathe in, you'd see your heart rate goes up, and when you blow out, your heart rate goes down. And the reason for this is the vagal nerve stimulates a sympathetic, which is your fight or flight nervous system, and breathing out stimulates your parasympathetic, which is your kind of your relaxation, your feed and breathe, digest, social engagement system. So if we actually measure the difference between those heart rates, when you breathe in, the height that your heart rate goes, and when you breathe out, how low your heart rate goes, that's called the heart rate variability. People with anxiety, depression, and trauma, they actually have a very low HRV. And so just by doing this exercise each day for like 5 minutes of breathing in for 4, holding and blowing out for 7, you can actually increase the HRV and put that relaxation system as your default more so. So some people, just by doing breathing exercises, have got off their anti-anxiety medications and off their blood pressure medications as well. So that's why we recommend this one. Progressive muscle relaxation, we start at your feet, we get you to tense them and then relax. So it's a relaxation technique. It could be also a mindfulness technique if you pay attention to the sensations that are in your feet when you tense them and then release them. Then we go up to the calves, the thighs, to the stomach, to the back, to the arms, and all the way up to the head. Compassionate hands exercise is a form of acceptance work. So many times we have difficult emotions that arise and we try to squash them. Metaphor I use for this is like, imagine a beach ball that represents anxiety comes into your path on a lake, and like you're, oh no, anxiety, and then you grab it and you push that beach ball underneath the water. So you get into a struggle with the emotion, holding it underneath the water, and it can help temporarily, but as soon as you let go to do anything that you need to do in life, hold a baby, wash the dishes, pop, that anxiety beach ball pops right back up to the surface, and now you're struggling with it again. So our goal is to build acceptance of, or allow these emotions to come and go, much like a beach ball on top of the lake water. It will come towards you, and then eventually through the wind or the waves, they'll just drift away. So we want to recognize anxiety or anger or whatever emotion that arises, not get into a struggle with it, just allow it to be there. And just be kind to ourselves by placing our hands on our heart and on our belly and just allowing this emotion to come and go on its own time. Intention setting is another important thing for going into ketamine treatment. So we have a handout for this. And the goal of intention setting is just kind of that, set an intent for the treatment. So sometimes people say, I want to get to the root of my depression, or I just want to feel some peace, or I want to understand why I struggle so much. And having these intentions and going into the ketamine session, it could actually have a profound effect on the experience. It's one thing to say the intention, but it's another thing to feel it. So like, remember when you're a little child and you make a wish and you wish with your whole body? That's kind of what an intention is here. You want to set an intention, but feel it with your whole body going into it. If that seems complicated to you, just fine just to have an intention saying, I want to understand this, and go into it. We say have an intention, but we say don't have an agenda. So if you're in the experience and it's not relevant at all to your intention, just let it go and just let that inner healer that you have take you wherever it needs to go. So it's fine to have an intention, but don't try to control the experience. The goal of the experience is kind of relax and let go and just let the journey happen. Sometimes if you struggle, a nice mantra that I use with patients so that they remember is kind of trust, let go, and be open to whatever comes. So trust, let go, and be open. So administration of the medication, it goes into the deltoid. We inject you here, and then we take your vitals at the beginning before we give the injection, 50 minutes after, then 30 minutes after, and at the hour mark, and then at the 2-hour mark when you go home. After the session, we debrief. So again, this is your experience, so only share what you feel comfortable with. Don't feel pressure to talk. However, more that you share with their experience, we're able to kind of pull out those difficult thoughts, feelings, those behaviors that you want to integrate, and then the values that you have. So the more that we can kind of have, the more that we can kind of change the behavior in your life so that it leads towards the life that you want. So again, share only what you're comfortable with, but again, the goal for ketamine treatment is to actually change the behaviors in your life. It's not just about getting the medication. Journaling, sometimes journaling is very effective. So after your ketamine session, if you just want to free write whatever, don't worry about punctuation or grammar, just write down whatever comes to your mind. Some people aren't the most don't like writing, they're more artistic and they like to draw. So you can draw about the experience. And what's valuable about this is, in like a month down the road, you can look back at your sessions, what you journaled, what images you draw, and you can remember the lessons and stuff that you pulled out of here, or the things that you want to work on. It kind of gives you a way to remember. Ketamine is a dissociative, so lots of times people don't remember the experience. So having a journal or images that you draw can help trigger that memory. And integration work, like I said, is actually integrating what we learned or what we developed or the coping skills that we worked on and utilizing them in your life so that over time, if the ketamine wears off, we have these new neural pathways from the behaviors that you've been engaging in. So today we would have completed a PHQ-9 and a GAD-7 on you, and so we'll do this again at the end of the treatment just to see if there's any improvement. So if you have any questions, you can ask those now, and then we also have some handouts here on intentions, on journaling, on informed consent, and on discharge instructions. So just to go over a few points again, you can't drive for 24 hours after you have ketamine treatment. You can't sign any legal documents. During ketamine treatment, try not to make any major life changes in your life. Wait a couple weeks after and see if that's still changes that you want to make. What we should note about ketamine, it's an off-label, which means that it's not being used for the intention that ketamine is prescribed for. So ketamine is actually an anesthetic that's used for surgery, and we found out over time that it has an antidepressant effect. But Health Canada or the FDA hasn't approved it to be used for antidepressants, so you need to be aware that you're using a medication that has not been approved yet by Health Canada. The other thing that we need to talk about in the informed consent is that ketamine can be addictive. So some people do abuse ketamine. That being said, people who have taken it in a medical setting and the protocol that we're using in all the trials, nobody has got a ketamine addiction. And if you look at harms of medication, ketamine is actually less addictive than benzodiazepines like Ativan and Valium, which you may have been prescribed in your past. So the potential for abuse is there, but I haven't seen it yet in our clinical setting. Okay, that's the presentation. I hope you found it valuable, and I wish you the best on your ketamine experience and treatment. Have a good day.